Hello, I'm Dr. Jerry Jones. I teach advanced electrocardiography for Medicus of Houston, where I'm the CEO and chief instructor. I've created a short video on the topic of subendocardial ischemia, something that is very often misunderstood by medical practitioners. So let's get started. For many years, we've misunderstood the concept of subendocardial ischemia as it manifests on the 12-lead ECG. Previously, if one saw ST depression in leads 2, 3, and AVF, it would be labeled inferior subendocardial ischemia, and if the patient were momentarily having little or no chest pain, the patient would be sent home. The same thing happened with ST depression in leads V4 through V6. Anterolateral subendocardial ischemia, probably chronic, and again, the patient may have been sent home. And of course, ST depression in leads V1 through V4, anteroseptal subendocardial ischemia, and occasionally the patient was sent home. Then a number of years ago, some disturbing information began to surface in various medical journals around the globe. Sometimes ST depression that was limited to just leads 2, 3, and AVF, for example, didn't reveal any actual subendocardial ischemia in the inferior wall of the left ventricle. In some cases, subendocardial ischemia was indeed present, but very little involved the inferior wall, and most of the ischemia was elsewhere. But the only ST depression present was in the inferior leads. Some articles began mentioning the same findings regarding ST depression in other leads as well. Now, what we've learned is that when ST depression indicates subendocardial ischemia, it does not localize. Now, let me repeat that. It does not localize. Just because there's ST depression in leads 2, 3, and AVF does not necessarily mean that the ischemia is located in the inferior wall of the left ventricle. It may be there, or there may be some ischemia there, but most of it elsewhere, or there may be no ischemia at all there. Some people still have difficulty conceptualizing this, so I developed an allegory of subendocardial ischemia using the concept of a vacant house at night. Imagine you've gone out for a walk one pleasant evening in your neighborhood. As you stroll down the street, you come upon a vacant house. You know it's vacant because the family that lived there moved out recently. However, you can see light coming from some of the windows in the house. You wonder what's going on, so you walk up to the house and look inside a window into the living room. The room's illuminated, but you don't actually see a light on in there. You move around to another window and look into the dining room. Again, there's enough light for you to see everything in the room, but you don't actually see any light fixture that's on. Finally, you move around to the window that looks into the kitchen. It's illuminated as well, and you can see everything, but once again, the source of the light is not there. Is the light in a room that you can't see, or is it perhaps in a closet that's been left on somewhere in the house? That, in essence, is subendocardial ischemia. Just because you see ischemia through the windows of leads 2, 3, or AVF, or the windows of leads V4 through V6, doesn't mean that the source of the ischemia is in those rooms. Subendocardial ischemia manifested by ST depression does not localize reliably. So how should you report such ischemia? This is what I would say if I saw, for instance, ST depression in leads V4 through V6. I would say there's subendocardial ischemia present, indicated by ST depression in leads V4 through V6. But I would not call it anterolateral ischemia. Actually, this information has been available for a number of years. So if you're reading textbooks, journal articles, or posts on websites that still refer to inferior ischemia, high lateral ischemia, anterolateral ischemia, and so forth, then you're reading information that's outdated. If it was recently written, then you're reading information from someone who's not staying current with advances in electrocardiography. When you do encounter ST depression that's localized to a vascular ECG area, 2-3 in AVF, or V1 through V3, or 1 in AVL, you should be more concerned that you're seeing the reciprocal changes to an acute transmural ischemia, i.e. a STEMI, located in a different area. Now, several years ago, I created what I call Jones's Rule to help keep myself out of trouble, but it is very applicable to everyone else. Okay, here is Jones's Rule. Any ST depression on the 12-lead ECG of a patient with an acute coronary syndrome should be considered a reciprocal change to an acute transmural ischemia located elsewhere on the ECG until proved otherwise. Now, there are two corollaries to Jones's rule. The first corollary: the reciprocal changes to an acute transmural ischemia may actually appear before the ST elevation of the ischemia. In other words, the reciprocal changes may come first. The second corollary: even when the reciprocal changes and the ST elevation are present at the same time, the reciprocal change may be much more impressive. Now, just in case you didn't believe me, here is an example of the first corollary to Jones's rule. Now, that is not subendocardial ischemia in leads V1 through V4. That is a reciprocal change to an infrobasal, formerly posterior, transmural ischemia, in other words, an MI. The reciprocal change appeared first. Now, we'll talk about something called Jones's sign in another video. Now, the second corollary to Jones's rule: even when the reciprocal changes and the ST elevation are present at the same time, the reciprocal change may be much more impressive. Now, those of you who are more advanced, you'll notice that there are a lot of hyperacute T waves in the precordial leads. Let's forget about those for a moment. Let's just look at the limb leads. If you look at just the limb leads, what do you notice first? You notice the ST depression. It's very obvious. But did you notice the ST elevation? So even when both are present, sometimes the reciprocal change can still be much more impressive. Now, here is a 12-lead ECG of an actual subendocardial ischemia, a true subendocardial ischemia. You'll see ST depression in 10 out of 12 leads. Now, does that look like it's localizing? If you would like to learn more about ischemia and infarction at an intermediate to advanced level, check out my book, Getting Acquainted with Ischemia and Infarction. Ischemia is not an infarction. It's available on Amazon.com and BarnesandNoble.com. And did you know you can learn more on my website? Now, I'm Dr. Jerry Jones. I teach master classes in advanced ECG interpretation. My two master classes that I am currently teaching are the master class in advanced electrocardiography and the master class in advanced dysrhythmias. Both are 4-day live and in-person events. Each master class is limited to just 20 participants. There's active participation by all in both classes and plenty of time to ask questions, even during the presentations. Unlike many seminars and conferences, you do not have to wait till the end of a session or presentation to ask your question. You can ask questions at any time. Now learn more about the masterclasses at my website, https://medicusofhouston.com. Now, I want to take this opportunity to thank you very, very much for your time and your attention. Before you leave, Be sure to subscribe to my channel and hit that like button. Thanks, and hopefully I'll see you in one of my classes.